Hi, I'm Dr. Michael DiTolla, the Director of Clinical Affairs for Sirona Dental, and I'd like to welcome you to this Sirona Media Panel, coming to you live from the 2016 Chicago Midwinter meeting. We have with us today our esteemed guest on my left, Lutz Hiller. Lutz, hello, how are you?
Hi,
From
perfect,
Oemus Medias, one of the largest publishers of dental publications in Europe. You guys have 5 different publications throughout Europe?
25.
25?
Yeah.
Oh, I was only off by a factor of 500%. That's pretty good for me because my math is bad. Just one quick question before we get going. What does an American dentist have to do to get on the cover of a European dental journal? Tell me you guys would never actually do that.
With you, yes.
With me? Okay, good. So it's taken care of. We'll consider that done then. Thank you for being here with us today. And you have to your left a couple people, Dr. Todd Ehrlich and Henning from Sirona, who is the product manager for zirconia and all the different consumable blocks. I'd like to let you go ahead and ask any questions that you might have about this procedure, the material, or any of those kinds of things. So take it away.
Yeah, first of all, congratulations. It was a big shot and very interesting to see what you developed here. My question is, what are the indications which are possible with zirconia by now?
Well, the way I'm using it in our office is obviously posterior units. Any time I have a situation where I think, man, that could potentially break or we're going to have an issue, we want to go full contour zirconia because the days of stacked feldspathic ceramics on zirconia, they're over. We need to go full contour because of not only the cosmetic portion of it, but the method at which we're using it. So now that we can take zirconia, which has always been a very laborious product to make, now we can do it so fast, it's going to just sweep dentistry. I can see it right now.
Wouldn't you say, Todd, that it's a pretty good common sense approach to use solid zirconia on most molars and then to use something like Emax on teeth anterior to that?
Absolutely, because just getting the stronger material, the less risk of fracture on the posterior units and back makes us feel better. And that's the most important thing, so that I can go home, sleep at night, and not think, I didn't do that one so great, and this is going to save me.
Especially if somebody clenches their teeth or grinds their teeth.
Right.
You're really not supposed to use some of those weaker all-ceramic materials in those situations, and this little guy is essentially bulletproof. You can hit it with a hammer, and it won't break if it's 1.5 millimeters thick, but it really does a good job of standing up in those difficult areas. Henning, do you see it fitting in well with the rest of the materials that are available to be fabricated chairside?
Yeah, definitely yes. I see the possibilities because of the high strength, so all the thicknesses, problems with space and so on, so that is the material of choice, and so I would say zirconium or CEREC zirconium is the perfect additional product for all the other materials.
Right. So today, it's probably not a first choice for the anterior, unless you had somebody who had just ground their teeth so much they'd worn them all down. There's certain people's mouths you look into, and Todd, I know you've seen them before too, where you're afraid to put anything in there.
Anything.
This might be your only solution.
I would never be afraid to put that in.
Right.
It just,
for that reason.
For that reason, it would just not be a problem, not at all.
So good question. Thank you.
Then one more question, what a dentist, new products, what do I have to invest? Which kind of devices do I need necessarily for the workflow in the dental office or the practice? Do I have to upgrade, or can I use my device I already have, or what are the needs?
First of all, you can use all your MC machines, MCX, MCXL, MCXL Premium, also with wet grinding. So new is a dry wet grinding or wet milling. New is the dry milling, but it's also possible to upgrade that, but only with machines they are dry milling ready. So we sell them a couple of months, and you can see that on the side of the milling chamber. There's small round plates on the side, but all the machines are not dry milling ready. It's not possible to upgrade on dry milling. But sure, you can also work with wet or milling or grinding. The only thing what you have to do is that then to sinter a little bit longer. But the software knows that automatically. So then it's a little bit more preheating for drying the restoration, and then the door is closed and sintered.
And that's it? You don't need more as a dentist? You need a little bit more products, or
No. What my experience is that we have the same milling chamber. It looks the same.
Yeah,
We use it the same. The only thing that's different is now we have that speed fire oven,
That's it,
but everything is automated, so we don't have to learn anything. So when you talk about upgrades in machinery, yes, there's things that you have to have differently. But as far as learning, there isn't much more to know, because if the doctor already is doing CAD/CAM dentistry, it would take you 5 minutes to learn how to do this process. So there's not any learning that's involved with it.
Yeah, in that sense, it's really a step closer to the ultimate solution, which is we prep a tooth, take a digital impression, and then 40 minutes later, it just spits out a crown that's done, and you just pick it up and drop it into the patient's mouth. But it is a step closer to that, because now the dentist doesn't have to have a separate staining and glazing oven from the sintering oven. They don't have to learn programs and cycles. The software tells the oven, this is how big this crown is, this is how thick it is, this is what shade it is, and then it does a custom sintering cycle just for that. So I love that idea of dentists having to do less. The less they need to know, the less we need to have a manual for it, because it's just all almost automatic. The more dentists we're going to see come into this and start adopting this technology, because the number one thing we hear from dentists in the States is, I like the idea, but I never wanted to be a lab technician. I never wanted to have to learn how to do all these things. And each step we take forward, we're getting closer to them not having to do any of these things and having the machine be responsible for doing most of this stuff.
Last question on my side. Do I have to paint, or can I paint, or on the material, or how is this working?
So you mean these stains and
Yeah.
Yes, it's possible. At that time we have no stains, but we make a validation, for example, with the Vita Accent Plus stains. Important is that you at first stain the restoration with the stains, and then you take the glaze spray for the glaze. So first the stains, then the glaze. But it works.
With the speed fire oven, it already knows how to sinter, like what you were saying, the exact formula for that one restoration, but then it already knows the exact cycle for the stain and glaze of it, so that maximizes the amount of time. I've been blown away how fast just the glazing cycles have been on this, because it goes right in, it glazes, it comes out, it's ready to go. Whereas if I use another oven that has a standard program, it's a standard program for every single restoration, it's always going to be 12 minutes, always going to be 13 minutes, but I've seen 7-minute glaze cycles, and they turn out great.
And that's the type of intelligent technology that I think the software should be able to do. It's kind of like, even with the new 4.4 software, when a dentist now does their digital impression, it gives them feedback on their preparation. It'll tell them if the margin's too rough, if they haven't prepared enough tooth from the antagonist tooth. It'll show them where the undercuts are. And this is part of the promise of this high technology to me, is that it's not just doing it high tech, it's getting feedback from the technology about whether or not you're doing it right. And in this case, it's telling you exactly how long to sinter it and exactly how long to stain it and glaze it. And anything we can do to make this easier for the dentist, we're going to see more dentists adopt this technology, because they have to be less technical, and they're going to have to be less high tech, because the machine's going to be able to do most of it.
Also, the maintenance of the machine has been fantastic, because there's a dust that is generated within the chamber, and all we have to do is run another cycle that we traditionally wet mill, and it cleans it all out. So, I mean, there's very little that's changed other than the oven, and you put it in the oven, you hit start, and with the smart technology, you don't have to think about anything.
Right.
So it makes it a lot easier as well.
Do you think there are differences between single session treatments between Europe and the US?
Not really. Yes, there are more in the US. They do the real single workflow. That is maybe the difference. The dentists, they do the single visit dentistry are the same in the US and Germany. But in Germany are much more dentists. They use a couple of times more to send them away in the town or something. So they not really work too much chair side. They say, okay, I need a little bit more time. So depends also on EMAG, so that needs a little bit more time. Now CEREC zirconia needs a little bit more time. It's not real really a share site restoration. It is one
Single
single visit dentistry. So it's a little bit more time, I would say. Yeah.
I'm a U.S. dentist, and I have all this technology. I wouldn't do it in 2 visits. I mean, it's made to be generated in 1 visit. It's made to satisfy the patient requirements and not having a temporary. So
Right.
I need to do it the way it's intended.
Right. Yeah, anything we can do. I'm on a personal campaign against temporary crowns.
That's right.
Because nothing good happens
Yeah.
while the temporary's in place. Nothing good. There's 5 things that can happen. They're all bad. Nothing good happens.
That's
we
right.
would not deliver any. We wouldn't do composites this way or anything else.
No way.
There's nothing better than getting the permanent restoration in on the same day. There's no reason we can't do it today, except for the dentist who says,
Mentality.
"I don't think I can do this," or "It's too expensive," or "I don't want to give my patients the best dentistry because I care more about myself than my patients." Well, Lutz, thank you so much for
pleasure.
coming
Thank
and
you very
asking
much.
us these questions. Thanks to Oemus Medias for being part of this. We're very happy to have you here.
Thank you.
And thank you for being part of the panel. Thank you very much. And on behalf of myself and my fellow panelists, I want to thank you for your time and your continued commitment to quality dentistry.